Hey everybody, let's review another topic for exam 3, and that's birth injuries. So a birth injury is literally any injury that might happen to the baby during the process of birth. That might be a nick in the skin, maybe in the scalp from the provider breaking the water during the amniotomy. It could be a nick when during a C-section, the provider might have gone a little too deep and the baby got a little cut or something. But most of the time when we're talking about birth injuries, it's referring to major events during a vaginal birth that cause injury to the baby. Not necessarily anyone's fault per se, but it's just a risk of delivery. This risk is much higher if the baby is macrosomic, so a big baby, right? So you might remember one of the big risks of macrosomia is an increased possibility of shoulder dystocia. And with shoulder dystocia, these two birth injuries on this slide are common. So first, I actually want to talk about the one on the right, which goes with the picture on the top with the X-ray there. So that you can see a clavicle fracture on what's probably the baby's right side, but when you're looking at the picture, it's on the left. So what you're going to notice in these babies is crepitus. So when you're assessing the baby, you're feeling its collarbone, and crepitus is going to feel like crunching, kind of like crackling sound, or feel when you're palpating the clavicle area. And you will also notice unequal movements. So remember, we do the Moro reflex, which is that startle reflex. And if we try to elicit the Moro reflex and one side is not responding, either unequally or not at all, then we would suspect a clavicle fracture. This actually can happen with the brachial plexus injury as well, too, like we're going to talk about. But that's one of the reasons that we do the reflexes at delivery, including the Moro reflex, to assess whether there might be any skeletal or nerve injuries to the clavicle or brachial plexus. So another thing, the next picture down there would be assessing the developmental dysplasia of the hips. And in that, you would see uneven gluteal folds where one side would have more rolls than the other. So on to brachial plexus injury. So brachial plexus injury is also associated with shoulder dystocia. And what happens is during delivery, the provider perhaps is pulling down, trying to free the anterior shoulder. So that downward motion is putting intense strain on this area and those nerves in there. So the brachial plexus is in there. You can have an upper or lower brachial plexus injury where it just depends on how much of the arm is affected. If it's a lower one, then it might be mostly the hand that's affected. And if it's upper, it might be the entire arm. So this can cause that Erb's palsy that you see there, a damage or tear. We mentioned already that it's from stretching and pulling and shoulder dystocia, and can cause paralysis where the arm hangs limp. So hopefully, if it's not too severe, this injury can be rehabbed and the baby can recover. Could take many months, but if it is a severe injury, then it could be a lasting effect from that. Next slide. We are talking now about the baby's head, right? So this slide mostly shows a normal changes during and shortly after delivery. So the newborn head, we would expect molding. Molding, of course, you can see in the skull diagram there that all those skull bones, they're not fused in the infant, so that it allows for the bones to, change angle so that it elongates or even can overlap. You sometimes, like this baby in the bottom right of this page, it's got the sagittal and parietal bones there overlapping toward the front there. So this is normal, and we would expect this. Those are expected findings when we do our assessment of the newborn. We're also assessing the fontanelles. The normal finding is that the fontanelles are flat, so even, pretty even with the skull bones there. If the fontanelles are depressed significantly, then we would suspect dehydration in the baby. Now we're not really talking about birth injuries per se, but we're just talking about assessment of the skull. But bulging could be related to a birth injury. If the fontanelle is not flat, but bulging, then we would suspect intracranial pressure and would notify the provider to assess the cause of that. It could be bleeding, like brain bleed, could be brain swelling due to an injury. So definitely part of our assessment of the newborn. And here we're talking more about birth injuries. So caput is an abnormal finding on the baby's head, different from molding, but very difficult to assess the difference just by looking. So just looking at this baby, if you didn't know, you might assume that this baby just has a lot of molding from delivery. But once on further assessment, you would see by feeling for how deep the skull bones are, that this is actually a lot of swelling. It's edema over the scalp. So the skull, if you keep pressing, is much deeper than on the surface as it was in those other photos that we saw that were just molding. So caput, we think of as a cap, meaning it's not off to one side or the other, the way a cephalohematoma is. So caput can cover sutures, because just as you would wear the cap on your head, it's covering all of our suture lines. Caput can do the same thing. So it's not always centered as it is in this baby. That baby kind of has caput right over its crown, it looks like. It's not always that way. It could be off to one side, but it would not stop at the defined edges of the skull bone the way the cephalohematoma would. It would just cover the area of swelling, usually whatever area was on the cervix. So it was kind of protruding through the cervix and causing swelling in this area that was kind of put under pressure there for an extended period of time. That's what you would expect with caput. So it's a normal finding. It's not something that has to be treated. It's nothing that's alarming, but it's still, that's something we want to differentiate between caput and cephalohematoma. This disappears in 3 to 4 days because it's mostly edema. It's mostly just fluid that the body reabsorbs, right? Just like if you, stubbed your toe and it was swollen for a little while. Cephalohematoma, on the other hand, is an actual bleed within the scalp. And so it is like a broken blood vessel that collects blood in that area. So what happens is it just continues to bleed until it reaches the edge where it's kind of encapsulated by the layers of tissue there, all the way to the edge of the suture line, and it swells out but doesn't cross over until hopefully the bleeding is stemmed by the pressure that is building there. However, you can see the skin stretches quite a bit and they can have quite a big bleed under there. This pooling of blood puts them at an increased risk for hyperbilirubinemia, for jaundice, because the body then has to start breaking down this huge pool of blood there. And as the body breaks down the blood, bilirubin, unconjugated bilirubin, is the byproduct that the liver can't really process very well yet. The baby's also not stooling, having frequent bowel movements yet. So it's all just kind of building up in the bloodstream. So cephalohematoma puts the baby at a higher risk of bilirubinemia, and it's also a birth injury. These can happen with vacuum, application of a vacuum, where it might kind of burst a blood vessel there. But it can also happen, say, in a precipitous birth, or just in the course of delivery. So not necessarily something that is caused by another human, like it's anyone's fault, but just an injury that we are looking for as a possibility. We're keeping our eyes peeled for these kind of birth injuries. So I hope that this helped you think through some of these occurrences surrounding deliveries, and please reach out to your instructors if you need any further clarification on these.